When I came to America and I progressed in my career, I was invited to a Skip Barber race school, and I did learn how to drive a race car and found that I had an enormous aptitude for it and fell in love with the sport. And another friend of mine took me into vintage racing, and the rest, as they say, is history. My cardiologist said, "You have a Formula One heart, but you have a Ford Fiesta neck." So unfortunately, what I had was genetic. It wasn't affected by thrills or spills or splashes on racetracks. It was just genetic, and eventually that part of my neck gave out.
If you talk to any neurosurgeon, they'll tell you that everything we do is an uphill battle. Everything we do is a challenge. And I enjoy that challenge. I enjoy the difficult cases. I also enjoy the simple cases, but the difficult cases can be very rewarding because when there are no other options and surgery is going to be the cure or the mode of treatment that's going to make the patient better, you can make a huge difference in their lives.
I never felt pain until the onset of this particular set of experiences, but when it set on, life really wasn't worth living. And if I hadn't have found Dr. Beshay, I might not be here. It was that chronic and that severe.
Our philosophy for spine has always been operative intervention only when absolutely necessary. And when we do proceed with surgery, if it's indicated, is to pick the least invasive approach possible for the patient.
I ran an executive search firm for 35 years. My job was to find highly qualified executives for our clients. And I used the same technique. I identified about 300 different surgeons in Dallas that purported to be able to do this. I ended up talking to many of them, and I picked Dr. Beshay because of his humility, competence, and the fact that he had successfully performed somewhere between 400 and 425 of these procedures.
Very commonly, it's going to be two surgeons in the operating room operating on the same patient, and that has resulted in dramatically less complication rates and more efficiency in the operating room. If I'm going to select one thing and say this was the most difficult thing about this surgery, is knowing when to decide, okay, it's time for surgery now.
Dr. Beshay, as promised, was there when I woke up. His first question was, "How do you feel?" And literally after 20 weeks of devastating pain, I was pain-free. It was like I'd been let out of jail. It was a wonderful, wonderful, wonderful feeling. One of the things you did say after surgery was that, and it didn't show up on the MRI, when you actually operated on me, you found that my entire disc had slipped out and wrapped around the nerve system. And you said something humorous like, "Well, I'm surprised you were functioning." And I said, "I wasn't, you know." It was so painful. But that was an issue, a tiny issue, that when you actually got in there, you found something unexpected and you were able to deal with it incredibly competently. Technology they use to brace your neck is made out of titanium. And the car I drive is a vintage car made in 1980, and there are many titanium parts in the car. So when I was gleefully showing friends the results of this surgery and the x-ray and this titanium cage in place, I sort of jokingly told them it had been taken from my race car and inserted into my neck, and that's why it works so well. Another reason I felt so comfortable with you is you treated me as an equal when I did ask piercing questions. You were absolutely direct and made 100% sense with the answers. And again, that increased my comfort with you as the professional that was going to perform this procedure.
It's very kind of you, and it's very humbling to hear that from you.